That's as far as I go. This is probably the hardest break transition, as John Cleese would say, and now for something completely different. So I'm Josh Yamamoto, Dr. Yamamoto. I am a cardiologist and one of the people who helped develop the Foxhall Foundation. The Foxhall Foundation works with Kenzen Do. What Ricky didn't tell you, Kenzen Do really means the way of wellness. There's one way to translate the Japanese character. And as you might imagine, and all of you sitting here, feel free to rotate your chairs because we're going to be facing this direction because goodness knows doctors can't do anything without slides and notes. The way of wellness. Ricky mentioned our community. What we're going to do is Dr. Thomas and I are going to spend about 10-15 minutes each, and then we'll kind of wrap it up for the day, talking about a few things. Our community. We go from 2 to 102. Wellness isn't something that just happens, and it's never too late or too early, no matter who you are. If you're my age, you have kids, no grandkids that I know, and that could be involved in karate. I should be talking to our nutritionist. I should be doing yoga. I do go to Mr. Ivan's Boa class. I'm one of the people that he cringes whenever he sees come in, but there we are. My parents, if they were here and not in California, they would have things to gain as well. We have the movement classes for our older folks, there's nutrition, there's always something. Now the Foxhall Foundation was actually Dr. Thomas's brainchild quite a while ago because we were helping our older people in the community. And we saw that people were losing function. They lose function in the body, and they lose function in what they can do, and they lose function in the mind. And you could say, how on earth did a cardiologist get involved with any of this? And unfortunately, a lot of the loss of function that we see actually becomes there's the physical loss. So we want everyone to be active, we want everyone to move, but there's also a sense that over time things change. And what I'm going to talk is just a few minutes is about strokes. And if watching that demonstration, I should talk about preventing heart attacks. But nonetheless, a few things about the short course on how to prevent a stroke and why do we care. This, in case you didn't know, this is where we are. This facility is here. It's available for all of us to do things. Everything I know is in this book. So if I say something you think, wow, that's really cool, I want to know what he said, feel free to go and get the book. We have a couple of copies left here you can pick up, or you can get one on Amazon or wherever you like. That's all I know. Now, the foundation. There's a few things we do. There's a few things that I want people to understand that this is how we think. Everybody ages. That's an important concept. I take care of a lot of folks. So sometimes I'll be in the office all day and see 24 people, and the youngest guy there will be 80. And I have an 86-year-old marathon runner in the audience that I won't call out, but the point is you can be healthy at any age, but we have to acknowledge that we do change. I can't do this stuff anymore, but it doesn't mean I can't try. We age, okay? So we are not immune from aging. We got to stop thinking of it as being a problem, think of it as being some type of awful thing. No, we should embrace that as we go through each step of life, there's going to be a difference. And we're all born with certain gifts. I could train my whole life. I'll never be able to jump across the mat, okay? That's just not my genetic cards. We have a genetic makeup. We have things that give us strengths. We have advantages. We also have things that, are limitations. And sometimes it's just flat out unfair if you're born with those genetics. But you know what? Why curse about it? Understand it and learn how to work with who you are, okay? Because we're not going to change the cards we're dealt, but we can think about how we play them. And this is a real point. And Dr. Thomas is going to go on this a little bit. Good health. The way of wellness. It isn't just one thing, and it doesn't just happen. This is an interactive process. Good health is something we build. The younger you start, all of Ricky's students who are this big, if they follow these lessons throughout their life until they become one of my patients, they're going to do much better. You have to build it. And it's a cooperative effort. It's not an either or. Yeah, there's at least 4 typos in my slides. If you find them, you get a prize. No. And when I say that it's not an either or thing, there's 2 extremes of people that I see. Some come in and say, I can do this all myself. I'm going to eat all the nuts and berries and roots and vegetables and run 10,000 miles a day, and I'm going to be perfectly healthy. Well, fine, but don't forget your genetics and time, because a lot of what happens to us is genetics and time. And you know what? That's where your doctor comes in. At the same time, I got guys who come to me and says, yeah, I'm not doing that. Just give me a pill. You know what? I can do a lot with pills. There's a reason I have so many 80, 90, and 100-year-old patients. I can do a lot with pills. But one of my favorite dumb sayings is, I got a pill for everything, but I don't have a pill for fitness. This is why we teamed up with Ricky. Because I can give you all the pills in the world. I can probably keep you alive with enough pills till you're about 90 or 100, and you don't have to do anything. But you know what? You're going to be just sitting in bed all day. Oh gosh, I'm too tired to get up and even go to the refrigerator. That's a problem. So we got to be moving. So it's a joint effort. You work with your doctor, and there's stuff that we can do and stuff that we need to ask you guys to do. I mean, all of us. And then we talk, I like to say that there's a new way of thinking. I'm going to mention new school versus old school quite a bit. Because in the old school, everything was a disease. Oh my gosh, if I don't want to even see my doctor, they're going to tell me there's something wrong with me, there's a disease. You know what? The new way of thinking is that we naturally age and things naturally change over time. So why start calling things a disease, but age well? Good health doesn't happen. It doesn't just happen. It's not magic. We build it. You got to build that, and that's what it is. Dr. Thomas has developed this way of thinking about it, an approach, and her slides, which are better than mine, are just going to go through this. All I'm going to do is mention a few things. We're going to talk about arterial health real quick and sinus node function. You're like, what on earth is that about? But the point is you got to get blood to the brain. You got to get blood to every part of your body. And again, all of us need to do our part. I need to do better at bow class. I promise I'll practice more. I need to be fit. I need to have good nutrition. And you know what? I need to recognize that time is going to happen and the pipes are going to be different and my ability for my heart to circulate is going to change with time. We put out this book 2 years ago. You can prevent a stroke. There was a story behind that. One of our original sponsors is a guy named Bill. And there was a story out in the papers a couple years back about the latest way you can stick a catheter up into your brain or something to treat a stroke. And he looked at me and he said, so Josh, what's the best way to treat a stroke? And I said, Bill, that's the wrong question. The best way to treat a stroke is to prevent it. And he was really taken aback by that. And he's like, you can prevent a stroke? And I'm like, yeah. So we turned his question into a statement. This is a declarative statement. You can prevent. And I like to emphasize prevent as an active verb. Active, 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 motion, fitness, movement, our choices, how we eat, how we live our lives, and what do we do to prevent? It is an active verb. Not we will prevent every stroke, but you can prevent a stroke. CDC said last week they are doing things other than viruses. 80% of strokes are preventable, but we have to be proactive about that. The original title, to be honest, was The Baby Boomer's Guide to the Prevention of Vascular Dementia. The publisher's like, yeah, that's too long. But you get the idea. I mean, dementia is a very challenging thing. Loss of our ability to function. We don't want that to happen. Part of it is vascular. So I'm not going to touch on the Parkinsonian aspects or the Alzheimer's aspects or all these other things per se, but one thing that we do know is that a lot of this is about circulation. And I also like to say that there is almost no such thing as heart disease. Gosh, I forgot who I was talking to the other day. I said, you know, you can pretty much prevent heart attacks. We got that. And it's like, really? It's like if you die of a heart attack, it's because we didn't do our job to prevent it early enough. Preventing a stroke is a little more complicated, but you can do that. And so it's not a disease. It's part of the natural aging process. What is a stroke? Cerebrovascular accident is the technical term. Cerebral means brain, vascular means circulatory, and this is why it's really a cardiovascular doctor's job and your internist's job to help you prevent that. Okay? Neurologists tell us how to deal with our brain after it's damaged, but your doctor and your cardiovascular people are the ones who tell you how to prevent it. I use the comparison sometimes, like no one's going to go to a trauma surgeon and say, how do I do maintenance on my car so I don't get in an accident? You know, it's once you've been in an accident, we need people to help us, but the idea is never to have that accident in the first place. So what does that mean? You interrupt or you impair, you don't get adequate blood flow. Flow is an important concept to the brain, so it leads to brain dysfunction, possibly permanent injury. So in other words, you get brain damage from not enough blood flow, but let's be clear, a stroke is brain damage. You're not going to live your life well if you have a damaged brain, no matter what you try to do. So we want to prevent that. That's the whole point. Prevention of brain injury. How do we do that? We got to get blood up to the brain, okay? So you want to have healthy arteries. You don't want to have gunk build up in the arteries, so you don't want to have rusty pipes. I love this picture. It's really gross. It's not dark enough you can see. This has nothing to do with the human body. This is just a pipe full of rust. And I mention that. Why? Because we have this way of thinking that, I don't know, somehow we can do some magical thing or eat the right berry and we'll never have any rust, but everything rusts. It's a process of chronic vascular inflammation, which I'll get to. So if you want to deliver blood to the brain, you have to have pipes that are healthy, and the problem is these unhealthy pipes, these older pipes, a naturally aging pipe, will develop plaque as a part of the natural aging process. I'll explain that a little bit. And then they clot. So getting a clot is a problem. We do have some sponsors, people who've helped out the foundation, people who do things to help identify things that give us strokes and how to prevent strokes and clotting as well. So in the old school, yeah, this is how you want to get around. And we always talk about blockage. You got a blockage. Oh, I have a blockage. Blockage this, block that. I don't want a blockage. Okay, well that's fine. But a rusty pipe is a little, you want to drink out of that pipe? No. So there's more to it than blockage. So this is what I want to drive, if anyone knows. Who knows what that is? What's that? That's the Cybertruck, Elon Musk's new Tesla Cybertruck. It's awesome. It's going to fly to Mars or something like that. Our new way of thinking. Arteries naturally age. And so you want to prevent plaque growth and minimize what we call the plaque burden. Okay, that's the important thing. In the old days, old school way of thinking is that if you have plaque, that's a disease. I don't want a disease. I don't have a disease. You know, don't tell me there's something wrong with me. No, but in the new way of thinking, plaque growth is actually a natural part of the aging process, and none of us are exempt. It's a natural part of the aging process. Again, the 100,000 heartbeats a day is just enormous wear and tear. You do that on the outside, you get scabs and scars. You do that on the inside, we grow plaque. So please accept this new way of thinking, that you're going to age, you're supposed to age. It's natural biology. Don't take it personally if you do. Now, in the old school, we always talk about risk factors. What are the risk factors for heart disease? I don't even know what heart disease is. Who knows what heart disease is? Well, it's heart disease. It's a bad heart. The term heart disease or heart failure to me is like going to your mechanic and the mechanic says, you know what? You got engine trouble. You knew? I knew that before I brought it in here. Why? What's not working? Is it the spark plugs, the distributor, the fuel line, the valves? What? Don't just tell me I got engine trouble. Don't just tell me I have heart disease and somehow I can avoid it with adjusting risk factors. The new way of thinking is that you have natural aging. Our arteries are going to natural age, and there are things that will speed that up. There are things that can accelerate it. So what we used to call risk factors, I mean, we obviously still do, but they're really, another way of thinking about it is, what are these things that are going to speed up natural aging? On our pyramid of building health, there are lots of factors in here. Whether you exercise matters, nutrition matters plenty, particularly in diabetes, which I double highlighted, and I promise to focus this better for Dr. Thomas. Ingestibles, what are you putting in there? It matters. Diabetes is, anyone know why we treat diabetes? Why do we even care? To a cardiologist, diabetes is the thing that accelerates vascular aging the most. Oh, and yeah, it depends a heck of a lot on what you do and what you eat and some other factors that may be genetically beyond your control. But you care because it accelerates vascular aging, okay? So we're gonna just talk about arterial health real quick. Okay, you wanna know the health of your arteries? It's not hard, you can just look. Nobody said cardiologists were all that bright. We just love looking at pictures. She's smiling, you can't tell. She's so happy. This is Denise. Come to my office, you too can meet Denise. Just kidding, you can. So you can actually just look at an artery and you can see healthy blood flow. We actually can't make it darker in here. Those are safety lights, but I'm gonna show you a couple of pictures. This is a nice healthy artery, okay? This black stripe here, that's somebody, that might even be mine. I have beautifully healthy arteries. I look every couple of years because that's what I do. And nice, healthy blood flow. Okay, sometimes, this is a guy my age. Oh, look at that. You see what I'm talking about? That's a little nubbin of plaque. And you know, sometimes those nubbins are, oh, actually a little bigger than you might think. This is a 55-year-old guy, okay? Yeah, he's older than I am. Anyway, so the point is how did he feel that? He didn't feel that. Is there something wrong with him? No, he's just a guy. This is what happens. And you know what? He doesn't have a blockage. There's plenty of room for blood to flow. There's no blockage, but he has plaque. He has plaque. Why? Because he's a human being. We all do. We're all going to grow it. You just would rather not have this. And you know what? This one I just thought was really cool. I don't know if you can see it in this, but it's a little round guy. There's a little mouth and there's an eye there. So I call it the Pac-Man. This is, again, this was a picture from 2 weeks ago. Somebody in my office, 60-year-old, great numbers, fit, exercises, but they have plaque because they're human. So if you want to know, you can look. It's not exactly hard. Sometimes they're bigger. I call this my dinner plate plaque. Sometimes they're way bigger. This one I think looks, I've had a lot of people tell me what they think it looks like, but this is, it's not even actually blocking flow. We can measure the flow around it. And I keep mentioning it's not a blockage. It's not a blockage. I work with another doctor who, I told him, you know, our patient, not anybody in this room, mind you, has extensive plaque, but no blockage. And he was like, how can that be? How can that be? It's because the whole freaking pipe is rusted and full of gunk. It just doesn't block flow. If you block flow, the brain may not work and you may have symptoms, but none of this is going to give you symptoms. Okay, and so again, the issue is you get gunk in the plaque, which is a natural aging phenomenon, chronic vascular inflammation, and clots can form. And that's a problem because if clots get downstream. This was a picture in my office not long ago, and look right there when I hit play. You see that? That thing is just flopping around there. Right there, okay? What is that? That's a clot. This guy was just, hey, have a nice day, come on in. Doc, your job is to keep me healthy. Hey, look at that. You got a lot more plaque than you think. I know you've been doing your job. You've been eating well. You're rational. You're not overweight. You don't even have diabetes. You exercise. But you not only have plaque, but you've already formed a clot. If I let that break free, it lands in his brain. Pick your favorite part of the brain and do without it. No. So he did fine. Okay, we gave him medications that let the body reabsorb the clot and stuff. So, but the point is, age changes things, and you don't really know your health unless you look. And the goal is, when we talk about preventive medicine, what am I preventing? I'm not preventing a number. The goal in life is not to die with good numbers or have a stroke with good numbers. The goal in life is to live as long as you want, as actively as you want, doing the things you want to do, without disability, without brain injury, without heart injury. So if we want to slow down natural aging, eat right, manage diabetes, those are very, very closely linked things. Understand the diabetes, eating well, don't smoke. I'm sorry, if you smoke, I got nothing for you. And make sure you exercise. We do think about cholesterol and blood pressures as things that accelerate vascular aging, and there's a lot you can do with them. And if you actually want to stop vascular aging, stop vascular aging. Whoa, you can do that? Is there like a magic way to do that? Yeah, but you're going to have to take a pill. That's where your doctors come in. And here's a little secret truth. Our little pills actually are better than anything you can do at stopping vascular aging, but they're not mutually exclusive, they're additive. Okay? And don't tell me, oh, I read that statins are bad. That's like telling me, oh, I read that vaccines are bad. Just stop. Because if you have that plaque and you don't want to lose your brain, you're going to have to let us help you. We can. Yeah, you got to take a pill. But you see your doctor so you know what's the right pill for the right person at the right time. Do we all need pills? Well, if you live long enough, if you're healthy enough, then you probably will benefit from that. It's like saying, does everyone have to take their car into the shop for maintenance and change the oil? You don't have to, but if you want to get a better running life longer, then yeah, you're going to have to do something. Old school, gosh, if I'm taking a pill, I did something bad. I'm sorry, I got over that a long time ago. So, you know, my dad, hey, great genetics, he died of his heart attack in his early 60s. Before I was really even out of medical school. And so I looked at all of his records, and it's like, you know, this is in the 21st century, this is appalling, because that just absolutely did not have to happen. He had plenty of atherosclerosis, which he found on autopsy, and we never bothered to stop it from growing. Ugh. And so, there's nothing wrong with you if you work with your doctor and you say, hey, you know, doc, I don't want brain damage. I know I'm going to age and I want to do it well. So there's this thing called science. Can we use any of that to help me? I'm going to do my part. I'm going to take yoga. That's important. And I'm going to work with my nutritionist. I'm going to know if I have diabetes. I'm going to do all the things that Dr. Thomas is about to tell us to do. But can you help me prevent vascular aging or reverse it? In the old days, we just talked a lot about cholesterol. This is not 1990. Believe it or not, we didn't even know what a heart attack was until the late 1980s. It has much more to do with vascular inflammation and clotting. Cholesterol matters. I didn't say it didn't matter, but that's not the whole story. Nowadays, we don't just say cholesterol, we want to stop plaque from growing, okay? You can have a perfectly normal cholesterol and you're supposed to grow plaque. Cholesterol is not evil. It's an animal-based molecule. All of our hormones, most of our brain is made out of cholesterol. Testosterone is made out of cholesterol. So obviously, some of us have plenty of cholesterol. Anyway, but the idea is that we need to understand how we're aging. And so we used to say, I'm going to take a cholesterol pill. Fine. No, now we say we take things to stop plaque progression. So if I give you a pill, it's not because I'm treating your cholesterol. I almost don't care. Obviously I do, but I care a lot more about the health of your arteries and that I stop you from plaque growth. So it's not about cholesterol anymore, it's about your plaque burden and plaque progression. So again, a stroke is a blood clot to the brain. And where do those clots come from? They come from our arteries, anywhere between the heart and the head, or they can come from inside the heart as well. And so there's, just real quick, and then I'll get to Dr. Thomas, then we can go out and have some food. Atrial fibrillation, AFib. This is a hugely important thing. What is it? Okay, what is AFib? It's when you kind of have a sustained irregular heartbeat, and it's important to remember that it's part of the natural aging process. So our natural heartbeat comes from the corner of the heart, which we call the sinus node. We beat regularly. That's a normal heartbeat. This is where we're getting to sinus node function, because like so many other things, that will age as well. I always like to think of my heart marching in step like a band, and somebody's supposed to lead it. That's our natural pacemaker, or the sinus node, the drum major of the band. But dude, Mr. Sinus gets old. We all know that our heart rate doesn't accelerate when we get older. Everybody slows down. If you're a young athlete or something, terrific, but if you get over 65, 70, 85, this slowing matters. And when you get slow enough, the band has a real hard time being organized. This is my alma mater. Some of these guys are actually professional musicians now, but they're not exactly staying in step. So it doesn't mean you're unhealthy if you have a regular heartbeat. It just means you're irregular. The only way you know is by doing an EKG, which is, again, regular, good drum major, irregular. See if you can even find the drum major. It's the guy in white going, really? What are you doing? Okay, some important facts about these irregular heartbeats. Several studies came out, one just a week ago. If you're 70 years old, not that anybody here is 70, 30 to 35% of 70-year-olds have atrial fibrillation, and the majority of them don't know it. 90% is asymptomatic, okay? And guess what? As little as 5 minutes of that can double your stroke risk. Basically, your heart's just not beating regularly, the blood pools, that gives it a chance to clot. So, understanding vascular health, understanding that it's a natural part of aging, and you and I have to work together to prevent aging, understanding that the sinus node ages and irregular heartbeats are a natural part of aging. Why do people stroke? Because nature happens. Symptoms don't predict risk. That's so important. Let me say it bigger. Symptoms don't predict risk. I really don't care a whit that you feel fine. I mean, I do. I don't want people to feel bad. But just because you feel fine doesn't mean we have any idea about what the health is on the inside. I want to be clear on that. Symptoms don't predict risk. Symptoms don't predict risk. You do not feel plaque growing. If you have neck pain, I actually kind of don't care. I say that. I really don't want people to hurt. But that's not what's dangerous. The plaque doesn't create pain. It just creates gunk that can get into your brain. And the irregular heartbeats. No one said you had to get dizzy and feel faint. I mean, if you are, your doctor needs to know about it. But you can have irregularity and you're not going to necessarily feel it. You have to have an EKG to look at what it's doing. So that's what these things, EKGs, ECGs, it's the same thing, just whether you want to pretend you're German. So you get the little monitor. I posed for that? No, anyway, or we give people a lot of little wearable monitors to record your EKGs, lots of cool wearable tech. The one that's probably best is the Apple Watch. It's not great, but it's good. You can check it out because it has a thing to tell you. You might be having EKG or AFib. Go ask your doctor. There's a little display about these monitors. The good folks at Abbott, which now makes its own St. Jude, these are little monitors that can go looking for AFib. They go under your skin for years. They're astonishingly helpful. Why? Oh, you just told me that we did a study where we took 6,000 Danes and put in monitors and 30% of them had AFib. And then we gave them something so they didn't have, the stroke rate was incredibly low. And they didn't feel it. But you can go look for it. If you have Medicare, it's covered. It's an office procedure. It's kind of trivial. All right, so winding up, a couple of important points, especially about AFib. The recipe is age, particularly in people with higher blood pressure and a slower heart. If you're older and you know your pressure's higher and you know your heart's kind of slow, you already have AFib, you just don't know it. It's extremely common. It's one of the major drivers of strokes. If you want to know if you have it, you got to look for it because it's not going to give you symptoms. It's usually asymptomatic. You don't cure AFib, okay? You don't have to cure AFib. You have to manage it. Keeping your heart healthy, staying fit is incredibly important. A little less than 1% of 50-year-olds have AFib, but by the time you're 80, it's about 40% that we know, and it's probably higher. None of my 100-year-old patients are free of AFib. They all have some. You don't cure it, you manage it. And always ask the question, if we're old enough, what am I doing to prevent a stroke? Okay, and it's usually as easy as taking a pill. A lot of folks, we just take an aspirin. Some people take something more. You notice the good folks from Johnson & Johnson left some information about Xarelto, a very, very powerful stroke prevention medication, whether you have arterial disease or atrial fibrillation. So we like to say our little mantra, remember the heart. D, work with your doctor, be a partner with your doctor, because you're not going to know your health on your own. You got to do this together. How's my heart? What are the health of my arteries? What are my rates and rhythms? T, is it time for me to do something or do something different so that I can keep my health as good as possible? Oh, my goal is to put this slide in every talk that I give. Why does everybody age? Because you have 100,000 heartbeats every day. Slap yourself 100,000 times and tell me you're not going to have a healing response. Chronic vascular inflammation, okay? Wear and tear on the inside is why plaque growth is universal. Okay, final messages. We are not immune from aging. You can't change your genetics. You don't know your health unless you work with your doctor and look, but you can look. Please don't rely on symptoms to understand your health. We're moving forward. We all get symptomatic eventually, but by then it's often a little bit late. Okay? Oh, did I say anything else? And once you know your health, know your options. I can't emphasize enough nutrition, and I like to call it nutrition and fitness rather than diet and exercise. That's just my way of thinking about it. I hate the word diet because I always feel like I've been bad and I'm failing, but to understand good nutrition, what works for me. And no one says I'm the same as everybody else. How many other half Japanese, half Irish, Jewish, Roman Catholics? No, I mean, so the point is my nutrition is my nutrition, which is why I'm so happy we have a nutritionist. And then to work with your doctor and to understand modern medicine works. Don't guess, and for heaven's sakes, if you see it on the internet, don't assume that everything on the internet is true, accurate, complete, and relevant. And prevent is an active verb. So, with that, if anyone has any questions, hopefully not. Did anybody have any questions? Good, no. What I want to do is, no, you do. I'd like to turn things over to Dr. Thomas real quick, who is really the heart, mind, and soul of this whole project.